Hi, my name is Vicki Sims. I'm a physical therapist with Gainesville Physical Therapy, and today I'm going to talk with you about Piriformis syndrome. Piriformis syndrome is a condition that you get that is associated with an unstable sacroiliac joint dysfunction. An SI joint dysfunction is when this joint becomes malaligned. Let's say you get an upslip with a posterior rotation of the ilium. When the SI joint is malaligned, it sends a signal to the brain that says, hey, help me out. I've got a weight-bearing joint out of alignment. So the brain says, okay, you muscles that hold posture tighten up. And the quadratus lumborum becomes tight, the erector spinae becomes tight, the iliopsoas, but the most adversely affected muscle is the piriformis. It connects to the underneath of the sacrum and goes to the top of the femur or the hip. It goes right through the deep part of the buttocks, and it's underneath the gluteus maximus, the large buttock muscle. When you have a piriformis syndrome, then you will have difficulty sitting. The most common symptoms are you just can't sit. And then prolonged walking will usually increase pain as well. Most of the time, patient will complain of a burning pain in the buttocks, especially with sitting, and usually sometimes a posterior leg pain or a pain down the back of the leg to the knee. Sometimes it'll go below the knee, but not often. And it is, like I said, exacerbated by sitting or prolonged walking. Now, what we would do to treat this problem is first stabilize the SI joint. You're going to have a piriformis problem, tightness, as long as the SI is unstable. So the first line of treatment is to stabilize the SI joint, mobilize it back into correct alignment, and then stretch the piriformis muscle on a regular basis. We usually teach you to lie on your back, one piriformis stretch. There's several, but a common one that we would teach, you would lie on your back, and then you would pull your knee toward your opposite shoulder. You hold the stretch for 30 seconds and you repeat it 3 times. And we usually like for you to do that a couple of times a day. Now, you should not stretch the muscle until it's painful. Be sure that you're not causing pain with the exercise. If you do, it may exacerbate your symptoms. So just stretch enough that you're getting a good stretch, but it's not causing any increased pain. I hope this information is helpful to you today. Thank you.